A fiery clash on Capitol Hill over the CBO's estimate this week that 23 million Americans will be left uninsured by the president's health care plan. That number disputed by many on the right and setting off a heated exchange between Senator Bernie Sanders and White House Budget Director Mick Mulvaney about the legitimacy of the CBO director and his predictions about the plan. Watch this.
You made a dismissive remark about him.
I made it.
Even the CBO. You guys appointed the director.
And again, all I'm telling you is that the results are awful.
But you appointed him, so let's go with that.
I measure performance by results, Mr. Sanders. And if you continuously
Your opinion is
numbers,
that the results are terrible. I'm suggesting that it was a member of the Trump administration who appointed this gentleman, not some kind of radical Democrat.
So we can agree then that the CBO puts out bad data.
No, we can't. We can agree that you guys are beating up on a man that you appointed because you don't like his results. But anyhow, get back to the question. Why tax breaks for billionaires?
Because they're not right.
There you go. Karl Rove joins us now, Fox News political contributor and former Deputy Chief of Staff to President George W. Bush. Karl, welcome. Good to have you here. Interesting exchange on a number of levels with Bernie Sanders and Mick Mulvaney. What did you think about that?
Well, I thought it was a pretty sharp exchange and reflective of the attitude in Washington. Look, the CBO says that if the Republican plan is passed, that 23 million people will lose their insurance coverage. Well, how can 23 million people lose their insurance coverage if Obamacare is repealed when only less than 11 million have gotten coverage with insurance policies under Obamacare? It doesn't make any sense. What they're referring to is 23 million people will not sign up if Obamacare is repealed. But the estimates from the CBO on Obamacare have been traditionally very, very bad. Here are the CBO estimates for what enrollment would be this year. Starting in February of 2013, they said 26 million people would be enrolled this year. The next year, they said in February of 2014, they said 24. They repeated that in March of 2015, and in March of last year, they said 15 million people would be enrolled in Obamacare as a result of the law. Now, what was the reality? The actual number is just over 10 million, which means that they overestimated by 16 million, or 260% in 2013, 14 million in 2014 and 2015, or 240% more. And 1 year ago, they overestimated by 150%. They were half again as many people estimated to be on Obamacare as they are actually on Obamacare. So I think Mick Mulvaney was absolutely right. Why trust their numbers?
They tend to take a look at what the taking away the program would do, but not necessarily what the replacement part of the program would do.
Excellent point. Making insurance cheaper and providing more options is likely to generate more people signing up, but they don't look at the effects of marketplaces. They look at what government does. Government always gets it right, therefore they overestimate. Markets never get it right, therefore they underestimate. They did the same thing on Medicare Part D. They overestimated the costs and underestimated how many people would sign up.
Unfortunately, you never find out what's in it until you live through it, for the most part. In terms of the language of Mick Mulvaney, which I find fascinating, you know, he's talking about a taxpayer budget, and he's saying, look, it's fine to spend all this money on these programs, but it's your money. So are you okay with us spending this money on this program if the program has been proven over years to not work, or if maybe there are too many people? Maybe, you know, 30,000 is too many people to work at the State Department. He's sort of approaching this in a novel way. Politically, can this work? Is that an argument that can resonate across America, Karl?
Only if people back it up with actions and there's not just only one voice making this argument. Look, I thought he did a terrific job at that press conference the other day when he made the point that Washington has a different kind of math than the rest of the country. In Washington, as he said, if you spend $100 this year and you spend $100 next year, that's a cut.
That's a cut.
In fact, if you spend $107 next year, that's a cut. And let me give you the real practical example. The Democrats are going around saying you're cutting Medicaid, and the Republicans are in their health plan by $880 billion over the next 10 years. Well, this year, excuse me, wrong whiteboard, this year, Medicaid We're spending $389 billion. Under the Republican plan, in 10 years, we would spend $469 billion in FY27. That's to $80 billion more than we're spending today, and 21% more. And they would say, the Democrats would say, well, that's a cut because it's less than what they would like to spend, not what we need to spend.
Thank you for the lesson. A lot of kids across America wanting to know why their allowance has been cut for the last 5 years. Thank you very much, Karl. We'll see you soon.
You bet.